to everyone. Thank you, Professor, for giving me the floor. Before starting, if you permit, I would like to wish a happy birthday to one of our esteemed elder named Dr. Colin Shenry. The work we are to present, as Professor Anne Marcelle Genevieve said, is the global burden of SARS-CoV-2 in vaccinated individuals. These are our disclosures. And since its emergence in late 2019, SARS-CoV-2 has imposed unprecedented burden of public health systems, which resulted to widespread of morbidity and mortality. The rapid scale-up of the pandemic led to rapid and innovative solutions. The development and global rollout of COVID-19 vaccine has marked a major scientific achievement. Within just a year, vaccines were authorized and distributed all over the country, which resulted in the containment of the pandemic by reducing the disease severity, hospitalization, and the case fatality rate. However, a key problem persists: the incidence of breakthrough infection, where fully vaccinated individuals, even after being fully vaccinated, still contract the infection. As such, understanding the real-world impact of vaccination on infection, hospitalization, and death is critical for future policies and vaccine strategies. These two studies try to evaluate the effectiveness of vaccine in preventing the infection. The one of our left, a multi-omic analysis showed that the vaccine is effective in reducing disease severity, but not in preventing infection. And the one on our left side reinforced the CDC 2024 and the ACIP guideline in prioritizing booster doses in adults. While clinical trials show high effectiveness of vaccines, the real-world data show some changes which varied according to evolving factors, such as emerging variants, where we saw the Delta and the Omicron variant at times shied away from vaccine immunity. And equally, the protection wanes over time. Many knowledge gaps still persist, like what is the true burden of infection, what are the outcomes among the vaccinated, and how some socio-demographic characteristics like age, vaccine type, and underlying comorbidities influences the pandemic. Henceforth, a global synthesis is needed to guide public health decisions, where the need for evidence-based insights. It is with this in mind that we decided to evaluate the global prevalence of SARS-CoV-2 in vaccinated individuals, more precisely to determine the hospitalization rate in this group of people, as certain factors associated with SARS-CoV-2 infection, evaluate case fatality rate, which we aim to guide future vaccination strategies and public health response in similar outbreaks like COVID. Our systematic review followed up the PRISMA guideline, which after the registration of our protocol in the Prospero, an intensive search was done in different databases like PubMed, MBase, Central, SNAL. Randomized and non-randomized trials, cohort and cross-sectional studies evaluating the prevalence and COVID-19 disease severity among vaccinated individuals, and participants who were included were studies that were included were studies carried out among COVID-19 vaccinated individuals according to some socio-demographic characteristics. Here we are presenting our results. After our query in the different database, we retrieved 1,988 studies, from which 312 studies only were included in our study. From this, most of the studies were represented in Europe, followed by America, where 47 were cohorts, 3 were case control, 23 cross-sectional, and 239 non-precise. Here we have, in the 212 studies included, only we could have the breakthrough infection. We had the breakthrough infection reported only in 136 studies, where we had a pooled prevalence of 25.2%, implying a moderate infection. We continued by regarding breakthrough infection according to vaccine name, where we found that the vaccines where we had the highest prevalence was CoronaVac as compared to other. We continued by looking at the hospitalization rate, where here the hospitalization is more or less similar to the breakthrough infection, where we had 29.3. But here we would like to precise that we could have this information only from 61 studies enrolled. And we continued also looking at the different social demographical characteristics and the clinical characteristics to see which could influence breakthrough infection, where we found that those with second dose, unfortunately, and those with third dose had higher prevalences, which may be due to the fact that they were mostly represented in our studies. And according to age, those less than 50 years were the most represented, which match what we know, knowing that younger people were those driven the infection, even if they had less severity and were less and low case fatality rate. We continued by evaluating the case fatality rate, which reinforced the fact that the COVID-19 vaccines did not prevent the infection, but it prevented severe cases and henceforth reduced case fatality rate, where we had just a prevalence of 4.3%. And we try evaluating also the impact of the different socio-demographic and comorbidities in the outcome, where we found that in the gender, male and female had approximately the same outcome, while those who took second doses, those who were fully vaccinated, those with comorbidities like hypertension, obesity, and heart disorder were those who had high case fatality rate. In conclusion, we can say that our systematic review and meta-analysis shows that breakthrough among COVID-19 vaccination is moderate, and similarly with a relatively low case fatality rate. As such, for future pandemics with similar outbreaks or similar futures like COVID-19, we think vaccination should be accompanied with standard management of comorbidities to mitigate severity and mortality among vulnerable populations like elderly and those who present comorbidities. We won't finish without acknowledging all those who help us in attaining our objectives. Thank you.